My name is Marky Menard, and I am showing my research on the autism spectrum in relation to the gut microbiome. So first, we're starting with the symptoms and treatments. So as of right now, there are no really medicines that will do much for autism. It's not a medicine-related topic. However, there are therapy options that we have for autism and to help really just better the life of an autistic individual. So we have the applied behavior analysis, which is ABA therapy. There's tons of ABA clinics throughout the country where they really just try to give them therapy options to help better their quality of life. And it teaches them how to regulate their emotions and become more independent and decrease maladaptive behaviors, which is just their frustration and big feelings that they have. And it also helps to increase their preferred behaviors, which is more healthy ways to go throughout life. So in ABA, they do speech therapy, occupational therapy, that kind of stuff. So in relation to the symptoms, we have behavioral symptoms. We have the poor social skills, poor eye contact, repetitive actions or words. We have cognitive symptoms, which is an obsessive interest in certain things and trouble paying attention in everyday settings. Some autistic individuals present with developmental delays and speech delays. We have heightened anxiety, sound or texture sensitivity. The bacteria that I found in my research, there's no certain bacteria that helps per se with autism. However, in the studies, it showed that they have lower amounts of these bacteria found in their gut, which these are all of the more healthy bacteria that we need to have a healthy gut and healthy life. And they just, in relation to the healthy individuals, the control group, the neurotypicals, they have a much lower amount of them, whereas for some reason they also had a higher amount of lactobacillus as opposed to the control group, which lactobacillus is good. It's a good bacteria, but they just had more, they found more in the autistic individuals than they did in the control group. And on the brain, we have the children with autism spectrum disorder who also presented with GI trouble. They were shown to have a more severe anxiety symptoms throughout their day. They had more irritability and they were more withdrawn socially. And we come to the question of why do all these things happen with autism and GI trouble? Well, what I found was that they have, with increased GI trouble, they have abdominal pain, constipation, diarrhea. Diarrhea was the number one symptom that was found in the studies conducted on several groups of autistic children. And with these symptoms, these three right here, they are just more uncomfortable and they're more likely to not want to interact with anybody or really just not want to learn. They don't want to sit down. They're just hurting. And it's very uncomfortable to have these symptoms. We all know that. However, with some autistic individuals that are maybe not as talkative, they're nonverbal even, they can't express that and they can't really tell people that. So the research shows that these are probably why their symptoms are more severe than autistic children without GI trouble. We also have the less beneficial bacteria was found in the autistic children with GI trouble, and they also had more harmful bacteria in their gut microbiome, and this ultimately ended up to show more severe symptoms. They also had more Clostridium present in the autistic individuals as a whole, not just the ones with the GI trouble, as opposed to the control group, which are the neurotypicals. And so this Clostridium, it can be good for you, can be bad. There's multiple different strains. It didn't specify which ones though. So here we have, how do we treat the brain? How do we treat the individuals with autism that just don't have as much healthy bacteria? So first question is, why do individuals with autism lack the healthy gut bacteria? There's many factors that could be wrong with it. There's food selectivity. Most autistics, they're sensitive to textures of different foods. They don't want to try new foods. They like to stay within their bubble of what they like. And so then we also have excessive antibiotic use. In one of my sources, my third source, it was shown that autistic individuals are given oral antibiotics a lot more often than the neurotypical children are, and we think that's probably because their immune systems aren't as good, because their bacteria is not as good in their gut, and they are just, a lot of them have more ear infections, and they're just slightly more unhealthy than a neurotypical, and some of them can't say anything, they can't say what it is, so they're just prescribed antibiotics. We also have environmental factors. In one of the studies, it was shown that the autistic children who had neurotypical siblings, they showed they had about the same microbiome as other households. It was really just a household problem with that particular study. The environmental factors can do a lot of damage to certain kids. We also have, how do we improve our gut microbiome? So with autistic children, it is a little bit harder to have them change their diet. As I said, they are more prone to just eating the same meals. But what you could do is, there's probiotics and prebiotics, a lot of yogurt. There's a list up there of natural probiotics. I probably wouldn't eat a whole lot of them, but it's an option. There's yogurts that are yogurt drinks and stuff. There's shakes that you can give kids. We can also limit their oral antibiotic use. So we just need to maybe focus on more natural ways to overcome certain things other than just prescribing antibiotics for everything. And we also have stress management. Stress does a lot onto your stomach, and it kills your bacteria and your gut microbiome just as fast as an antibiotic course would. So ending off, I have some key common words and phrases that I found throughout all of my sources that I didn't know of. I knew autism spectrum disorder, ASD, but that's just there so everyone knows. We have GI is gastrointestinal, and then we have the gut-brain axis is communication network between gastrointestinal tract and the nervous system. And then dysbiosis is one that I've never heard of that one before. It is an imbalance in gut microbiota, and it's where there's more harmful bacteria than helpful bacteria. And those are my citations.